So this is Shadi Reyes, and this is SIF 2021. With me is Dr. Jonathan Schwartz. He's structural heart doctor at Singer Heart and Vascular Institute. He has been out in the practice for almost 3 years. We're going to talk about structural heart, practice, and COVID. Jonathan, always nice to see you.
It's a pleasure to be here. Thank you.
Finally, we see you in person outside the Zoom world.
I think our last meeting was just over a year ago. So.
Exactly. So, Jonathan, how's your practice set up right now? You are almost structural interventionist. I would like to pick your brain on people coming up to the job now or been in the job for recently with the COVID challenge. What was the things that you and your group worked on to keep the flow going and the cases done?
Certainly. It was difficult at first. We had a pretty big pause in the amount of cases we were doing, and we came up with a plan to sort of isolate our interventionalists into two groups. So in case there was an outbreak, we wouldn't have all the interventionalists need to go into quarantine. The patients coming to us in the outpatient setting dropped off significantly. Inpatients dropped off initially, but then sort of came back up. One of the biggest challenges was we're involved in a lot of research studies, and we had to pause many of those. The cases that we deemed that were life-saving, such as TAVRs and things like that, we continued to do those throughout the pandemic. The volumes have sort of ebbed and flowed a little bit, but we're basically back to pre-pandemic levels now. So.
And how's your practice for outpatient now? Do you screen all your patients by testing them?
Yes, so a lot of the very first visits are done virtually now, which there's a lot of, I think each doctor has their own preferences there, but I find at least for the first visit, it tends to work pretty well. Yeah. There are some that definitely prefer to come in to have things explained in person, and they like to meet their proceduralist beforehand, which is reasonable. Yeah. The referrals are starting to come back to pretty much normal levels. We talked with our referring doctors and just tell them that we've had a great result so far. We haven't had a single patient get COVID during these procedures. We make sure that they're kept in separate wards from all the COVID patients. So that part's been good, and I think we're pretty much slowly transitioning back to pre-pandemic setting. I do think the virtual part of things is going to play a much larger role than it was before COVID, since we've
still going to exist.
Exactly.
But it's going to be a hybrid mix like what we're doing now.
We've proven that it works, and I think a lot of patients prefer it. So.
Absolutely. So SIF now showing a lot of technology. There's a Watchman Flex, and new valves, as well as shockwave. And how you could transition or add this new technology to your lab, training your staff, nurses, techs, in the COVID time?
Certainly. So I think it differs a little bit based on if it's an iterative technology or whether it's something brand new. So Watchman Flex, from a staff perspective, pretty much the same. The prep of the device is very similar to the old device, the Watchman 2.5. Most of the differences come on my end in how it's deployed and how you kind of adjust things as you need to make it fit perfectly. Usually it's the companies that approach us with these things, but I think it doesn't hurt to ask. If you're at an institution that doesn't quite have it yet, just talk with your local rep and see when it might be available. Yeah. Things like shockwave, our institution is very interested in new technologies, and so I think the companies know that, and so they often approach us early. In particular, I think
it's easy to transition. There's already a pathway built already.
Exactly, and that way we're sort of lucky. I think if you don't have that pathway, a great way to establish that is coming to meetings just like SIF here, where you can speak with all of the companies here. You can see, based on the presentations, what is being used, and potentially establish a relationship and bring it to your lab.
Right, absolutely. So, beside the new, how about research? I was worried a little bit during COVID is the recruitment for trials is like almost stopped. So do you think we're going to have a lag in these results at least a year or two?
I definitely do. I think a lot of trials were put on hold, and that stopped enrollment for a while. It's sort of led to a bolus of patients now that we're sort of nearing the end of it, and so maybe that'll help catch things up a little bit. Yeah. It does not seem like the submissions to the big conferences have really slowed too much yet, so it might be delayed, I guess. We'll see. But there's still a lot of interest in getting restarted, and I think during the pandemic, it's sort of allowed practices and physicians to talk to their referrings and maybe educate them on all the trials that are going on. Absolutely. And so hopefully that means now that we're back to referrals will increase again.
Absolutely. Well, I mean, this is becoming it's a new norm now, living number one, adjusting to the virtual world for education and learning, communicating with our industry partner to learn something new and bring it to your lab. And then the recruitment. I mean, we just want the patient to trust us that the hospital are now clean and we have a certain procedure so they show up. Speaking of that, have you noticed any late presenters coming to your ER? And is it something an eye opener, and what did you do to make it aware of the patients?
Definitely. Particularly that has been most noticeable in the late presentation myocardial infarctions. Many cases with kind of old clots, big Q waves on their EKGs. Sometimes you go in and you still try to open it because maybe they have ongoing pain or something, and it's a much more of a struggle to open the vessel than it would be in a more of acute setting. I'm sure you've probably been similar for you.
Yeah. I mean, we had a very young average, like 45, 46, couple of patients like that. And the LAD came completely shut down. We tried every no reflow procedure you could think of: microcatheter, distal injections, aspiration. I mean, unfortunately, she lost that anterior wall completely, and she ended up leaving the hospital with 15%. It's just because the fear of COVID and coming to the hospital to get infected.
Yes.
Which is what we're trying to do in our hospital to increase the public awareness that COVID is here, we know, but the heart disease did not stop and still the number one killer. This is a pandemic, comes and goes, but the vaccine is here.
It's a struggle. I think even no matter how much public education you try to get out there, it's a scary disease, and people don't want to have any chance of getting it.
Especially if they have family that has it. Well, Jonathan, always nice to talk to you. Nice seeing you. Thank you for your time. Please watch this video and others on SIF YouTube channel. This is Shadid Reyes from SIF 2021. Thanks, Jonathan.
Thank you.